Okay, I'm back. I'm sorry about that, guys. That didn't work out. So I wanted to be able to see your comments, and I was having some issues with seeing the comments. So if you get the chance, you can jump back on live, and we can keep the discussion going, and I'll push back the time for you guys on the other end. So So I'm going to just, as you come in, if you have other people who were a part of it that you know, if you can share with them. I had to start another live because of the comments wasn't visible. So I'm doing it again. So I'm going to give you guys the time back on the back end. I know you guys are busy, as am many of us. So I'm going to just leave a message so everybody can jump back in. Feel free to let us know where you're from. And I'll give everybody about 5 more minutes. It's 8:32 to jump back onto this drive. Okay. Okay. Thanks, Laquana. Yeah, technology definitely is not my friend today. So, okay. So people are starting to come on. So I'm going to give them a little bit more time. And one of the things, if you want to, while I give everybody like 5 or 7 minutes to get on, go ahead and um, feel free to sign up for your Duns and Bradstreet if you haven't gotten a chance to do that. So the website, the website is dnb .com. So that's the website. And I'm going to leave it here. Okay, perfect. Awesome. So I'm just putting it in the website now. Oh, okay. Thanks, Laquan. I appreciate it. Right. So it is the DMV something we also need for business credit. Right. So it's kind of something that's used. Perfect. It's something that's used on the federal level. So it is used as a commercial credit tool. I think some of the funding companies use it to check clients to kind of see their pay history. So definitely. Okay. So we got a few more people that are trying to get in. So I'm going to get with them and give them a chance to get in. If you guys can just hold on, feel free to introduce yourself. I think Sheila, you said you were on here. Um, if you can just introduce yourself and let us know where you're coming in from, that would be great. Oh, you lost me again? When you say lost, Merlin, what do you mean? I see you posting. So is it that you can't hear me or? And another thing I mentioned on the last one, you guys will get access to this session. So if there are any issues as far as hearing or anything like that, you'll actually get access to the full video once it's over sometime tomorrow along with the presentation. So you'll have all the tools and resources. So if after the fact you have any questions or anything like that, you can feel free to reach out at that time as well. So, okay. So So we're at about 14. So we have a few people that are still missing. But I'm going to go ahead and get started to give you guys your time back. It's 8:36, and then more people will join us as we go along. Okay, perfect. Yeah, so it's hard for me to, as a little bit of a side note, so the Facebook Live sessions are awesome, but it's hard for me to walk people through how to get in because I've never gone in on that side of it. But my understanding is once you purchase it, you just click on the event and it kind of pushes you into the page. So, hi, Stephanie. Hi, Shalandra. Hi, Laquana. Marlarnde. Let me know if that's how you say your name. Sheila, I think she's on here. We got a couple other people. So we're at 14. So we're going to go ahead and get started. So I'm going to start from the beginning. So under the event, there's a lot of information, as well as there's also a group that I created, and it's called Getting Agency Ready for Local, State, and Government Opportunities. And just to clarify, when I talk about local, I'm really talking about at like your city level. So local would be city, county, it would be parish, if you're a parish, townships, I think that's what they're referred to in New Jersey. So like whatever that level is that's under your state that kind of runs your operations. So, and then of course state is state, and then of course your federal government is your FEMA, is your Department of Defense, Health and Human Services, CDC. Those are all your federal levels. So I'll touch on all of those things, and everything that you're doing to kind of get agency ready will apply to all of them. Hi, Teresa. Hi, Kamisha. So a couple of things that I said you guys should work on, and like I said, you'll get the presentation in the video tomorrow, is to get your Duns and Bradstreet. And kind of like what Laquan was mentioning, it's kind of like a business credit for the federal government. So the federal government does require it. States also require it, but it's state specific. And then county, it would vary. But it's something great to have. It's something and a tool that's also used by funding companies to kind of see the payment history of different businesses, commercial and private, and government agencies. So you want to have that. So it's free to get it. So you shouldn't be paying anybody any money to get it. A couple of things to note when you do the process of getting it. You want to make sure that you have the proper documentation to upload. So at the end of the process of, submitting your address, the location of your business, information about your EIN number, and it's usually maybe like 2 pages. They're going to ask you to upload documents. So it may be a document related to your business entity. It could be a document that talks about your EIN certification you got from the IRS, or your workers' comp, or your professional general liability insurance certificate there as well. So you want to make sure, hi Crystal, hi Teresa, that you have that already downloaded onto your computer somewhere so that you can upload it. And this is why. I've gone through the process. A lot of nurses have gone through the process. With the exception of Florida, there's just a few states that kind of push you through that process when you register your business with them. And for the rest of us, you actually have to do it separate. So when you do it separately, if you don't have the right documents in place, they're going to tell you they can't give you a number. And ideally, it shouldn't be an issue, except for they're hard to get in touch with. They're very vague as far as what that means, because I got that response when I first did it. And when they reach out, if you don't catch them, a week goes by and they're going to just tell you we can't issue a number, which essentially really means that you either need to get in touch with them and fix whatever they're asking you to fix, or that you would need to reapply. So if you don't know what you made the mistake for in the beginning, a lot of times you'll make it again. So save yourself the headache and have all that paperwork together prior to applying to that. So once you get your Duns and Bradstreet number, then you can actually register with SAMS. So most of us should be familiar with SAMS because we use it as a part of the background investigation process. It's the System Awards Management System. And it's essentially tied to whether or not employees, and then there's also an employer side, have gotten any awards or have any sanctions or anything on their background that prohibits them from applying to federal contracts, federal, local, state contracts. So the side that most of us have been on it has been related around employees. So like going into facilities that are mandated through Medicare and Medicaid, you can have an employee who has sanctions on them from working at federal facilities for whatever reason, working at those facilities. And most of that is included in the background check that you do. It's usually a line item. And they call it OIG/SAMS or SAMS or OIG, which is our Office of Inspector General. So once you do that, you're kind of in that ready stage. So you're ready to kind of get moving with the process. And kind of to preface some of this, a lot of the interest, I think, that people have had, myself included, around kind of getting your agency ready was a lot of the FEMA contracts that we've seen last year for COVID testing. And a lot of them were at your state, local, and federal levels. And, you know, they were having all these outrageous prices as far as bill rates, pay rates, terms, everything, short term, long term. A lot of NOSAs had asked, hey, you know, within the group or individually, is this an opportunity for me? Do you know anything about the COVID contracts? And honestly, I didn't. I really don't know anything or didn't know anything at that time. And a lot of the information that I've learned has been over the last couple of months. So next you want to do this. And this is something that you can kind of do in tandem of getting your DUNS or waiting to get your DUNS number and your SAMS registration completed. And that's identifying your SBA certifications. And that would be your women-owned business, minority-owned business, veteran-owned business, your 8A, all of those designations and certifications that the SBA provides or hub zone are beneficial to you because certain contracts, whether it's at the local, state, or federal level, are set aside for those individuals. And when you guys see the presentation, you'll see. And then finally, once you're doing that, and that's an application process as well, you can also look into subcontracting opportunities. So I know all of you guys in the group saw the post that I think it was Jarvis did regarding the FEMA COVID vaccination contract. So FEMA did put out a request for a proposal. I want to say the 26th, like the end, close to the very end of February, looking for agencies to submit proposals. The way that they set it up was that it would be two primes who would do staffing of, I think it was 1,500 on the East Coast and then 1,500 on the West Coast, kind of broken out where the FEMA regional offices are located. And from there was an opportunity for NOSAs and other individuals to subcontract because the numbers were so large. They were looking to have people deploy in like a 72-hour notice. So even your best agencies would struggle with filling that need. Like if they need 625 NPs or PAs or registered nurses or pharmacists, that's a big amount of people, and that's a short turnaround time. So some of the things, and I shared the RFP, and I'll share it here when I send you guys the video. Some of the people that submitted their request for proposals also reached out to smaller agency owners that they knew about to assist them with this in the form of a subcontract. So there's a lot of subcontracting opportunities. It's not specific to the local, state, and federal ones, but they're a little bit more beneficial on that side. And I'll talk more about how it could be beneficial. So they were looking for subcontracts, and then that was kind of coincided with Jarvis's post when he was asking if other people had been reached out to. Our agency and a couple of other agencies did get an outreach from a prime. And essentially, and you guys kind of let me know as I go if I use too many acronyms or words that you may not understand. A prime is the prime contractor. So they're the individual that has or would obtain the contract. From what they updated, 36 companies submitted to be primes on a contract that's supposed to go to 2 companies. And then under that, they may have reached out to so many smaller agencies to provide subcontracting services for that. So that prime subcontractor opportunity is really available in a lot of the contracts for the federal, state, and local side. They'll indicate in the request for a proposal where or if it's an option, and then it'll be up to you as an agency owner to kind of determine what the agreement is. And some of the things that you would have to figure out is how much your agency is going to bill, if you have the manpower and resources to meet the needs, the terms, the payment terms. You would also need to determine who would be responsible for what. So in this particular scenario, and in most scenarios, the prime would kind of be responsible for kind of that overall piece where they would kind of manage the overall piece of the project, and their subcontractor would be more specifically responsible for the providing of the people. And what I've seen and heard, the prime would be responsible for payments, paying the people, and it may look in different variations. You will be responsible. It would be more of like a agency recruiter relationship. So you will be responsible for obtaining the people, finding the people, potentially credentialing the people. Maybe not. That might be something the prime does. And then maybe paying the people if that's the agreement that you have with the prime. But all of that stuff should go into an agreement that both of you guys would sign and agree upon, and then that's how you would operate. One of the other benefits of operating as a subcontractor is you don't have to have like that full responsibility. So your primes will be responsible for the entire contract, along with any reporting requirements that the government is asking, any follow-ups. They would be the point of contact for the contracting officer, or CO as they refer to it as. Any issues they will be responsible for. So some of that responsibility is taken off of a subcontract. And if you're new to the industry, that's kind of a good stepping stone, because it allows you to focus on what you already know how to do, what all you guys already know how to do, which is recruit for staff, but also learn the process. So you'll learn the process of what does it look like to submit a proposal for an RFP, because you'll be submitting those documents to the prime. You'll know what it looks like to determine and create bill rates and what things need to go into that. So that's some of the things that I would encourage others as you're kind of jumping into this journey of getting into that industry to consider. In the same way that you would do it in a private setting. But one of the bigger benefits is that you can kind of work, your prime could potentially kind of work as a mentor to you. And then you can also use your experience with the prime towards additional contracts. So RFPs are requests for proposals, Stephanie. And you'll see a lot of that in contracts. And I have in the presentation that I'm going to share with you guys frequently use acronyms, and I'm going to touch on them a little bit too. So let's go ahead and touch on it. So some of the frequently used acronyms are RFPs, COs, which is typically your contracting officer, your DUNS number, which is your Data Universal Systems number, SAMs, your System for Award Management, and I'm just going to touch on these. You guys can see all these. FAR, your Federal Acquisition Regulations, BPA, which is a Business Purchase Agreement, HubZone, Small Business Administration, SBA. So there's hundreds of acronyms, and a lot of federal, state, and local agencies use a lot of them, and myself included, since I have worked for the federal government before. So I'm kind of accustomed to some of them already. So I would definitely familiarize myself with them so that when you see them in an actual contract, you'll know what it's talking about. A lot of the contracts are, I want to say, contracts can be 50, 60 pages easy. But some of the areas that you want to focus on, and I touch here, is your statement of work, because that's going to kind of tell you, hey, this is what we're looking to do. This is what we're looking for somebody to do. And then your scope of work, meaning these are the types of people, positions, and duties these individuals are going to be, we're looking to have these individuals do. So where do you find the contract? So you guys already know part of the answer. It's at beta.stam.gov, which is free. You can register your business, your email. It's totally free, guys. So go ahead and do that tonight. And you're also able to do a feature that I'll highlight here to follow a contract. So say, for instance, there was another contract that came up with FEMA vaccinations or what have you, and you wanted to follow it to see if there's updates. So a lot of times once a contract comes out or request for proposal, it'll be updated by the contracting officer on a regular basis. So a great example is this FEMA vaccination clinic contract came out the 26th. It's been updated 3 times. As well, they also updated, so it's been updated to make changes. So they've reduced the number of people that they intend to deploy, but they've also added some different things in there to give clarification based on questions and answers. So every agency allows you the opportunity, even at the state level and local level, to submit questions and answers. And I encourage you guys, even if it's just something that you're interested in, to do that. And what that allows you to do is get an understanding of, Shanika, it's sam.beta.gov or beta.sam. Sorry, I'm going to put it here. That allows you to get an idea of the types of questions that people might be asking. And one of the questions that came from this last one was whether or not they were asking for like 3 years of experience for some of the nurses to have. And one of the agencies submitted a clarification question on that, because we all know a nurse doesn't need 3 years of experience to do an IM injection. So they clarified that, and then they actually updated it and changed it to 1 year. Another question was around physicians, because physicians was one of the roles that they were recruiting for in their experience. Could interns also do it? So it's kind of like a living document until it's actually awarded to an agent, to a staffing agency, or whoever they're trying to look to fill that particular need. So the website it's beta.sam.gov. Sorry. Okay, let me try that again. I think it's at the top too. And another thing for you guys to consider when you're looking up some of your state agencies is if it has a .gov on it, or county or .co.com and stuff like that, that's an indication that it's a legit website. Miriam, I just posted is beta.sam.gov. If it doesn't have a .co or .gov in the actual search box when you search for it, then it's probably not a legitimate website, and it's a service or company that's offering to look for contracts for you for a fee. But with anything in your state and local governments, it's free to find the information. I will be honest, sometimes you have to look and dig a little bit harder, but all the information is public information, so it's out there for everybody to access. And I have here on the slides all the websites. So beta.sam.gov, GovTribe is also a great tool that lists out government contracts. And then another tool or resource is govspending.com. And don't worry about trying to remember this. When I send the presentation, I put it on there already. So let's touch a little bit on your state and local contracts. So like the state of Florida, or Montgomery County, which is in Maryland, or Kent County, which is in Delaware. Those particular agencies also have contracts. So for the state of Delaware, their contracting website is bids.delaware.gov. So I encourage you guys to look up those specific ones for your state and local as well, because a lot of things are run through the state. For instance, the Veterans Home in Dover is run by the state. It's not a federal veterans home. Some of your mental health hospitals and clinics are run at a state level. It's not a federal or local program. So those are also great opportunities for you to provide staffing services or medical services or clinics and things like that. So they all kind of need similar types of services. So look into those as well. So a couple of other things to note when you're thinking about getting into this space is to be prepared. And I'm always telling people, and I know you guys have heard me say this 100 times, do your research. So there's a lot of information out there that's free. And then there's also people who offer services that you can pay for. But I encourage you to go ahead and do your research from the free things so that you can determine if you need the services of an individual. And look for other resources, like a great example would be Clubhouse. Like, I know everybody has different opinions on Clubhouse, but it's actually been a resource for me. I was able to, or I'm working with somebody on another subcontract through just a connection on Clubhouse for temperature screeners at one of the Department of Defense facilities. And that was, it wasn't something that I was looking for. She connected with me. I saw an opportunity and we decided to work together. So, you want to really network just in the same way that you would network for your healthcare staffing on the private side, but move more into the government space. I know there are a lot of clubs and groups on Clubhouse. There's a lot of groups on Facebook and LinkedIn, which are all free, that can give you more information or even just allow you the opportunity to ask questions, much like what we're doing here. So I really encourage you to start there before you start paying for people to provide you insight and services for things that are already readily and freely available to you. As well, some of the best resources that'll get you in the door to these things is PACT, P-A-C-T. I think that's been shared in the group a couple of times. They have people that are specifically assigned to help new agency owners or small businesses kind of maneuver through the process. You want to, your Veterans Administration typically has a liaison because they do have the designation of set aside for veteran-owned businesses. So they do have liaisons that work with you. Connect with those people at your local Veterans Administration office for contracting. As well, SBA has the same thing, Small Business Development Center. They all have a facet of their business that receives money to do just this, to sit with you and you say, hey, I'm interested in this particular RFP. What do I need to do? What do the steps look like? And even if you submit on it and you don't get awarded the contract, you can always also reach out to the contracting officer. So for every request for a proposal, contract set aside, there is a contracting officer, and that person's responsibility is to assist agencies who submit proposals for those things to maneuver through the process. Now, don't get me wrong. Sometimes they won't get back to you as soon as possible, but if you aren't awarded a contract, they will provide you feedback if you reach out to them. So those are some things to really consider when you're looking to get yourself like agency ready. And then a couple of other things to note is that there are contracts out there for Indian Health Services, which is a huge contract that does a lot of contracting out of medical services or medical staffing services. They have different contracts out there for like 2 ICU nurses. We can fill that. 2 ER physicians. We can fill that. So I wouldn't be too discouraged to say, hey, it's federal, it's state, it's local, it's so big, it's all these steps. But I really would make sure that you take out the time to educate yourself about the process and ask questions and get like a good, clear understanding. Because if you don't submit things by a specific time, if you don't submit it right, if you miss something and it's not set up properly, then that kind of gives them the immediate, okay, her application is going to the side. There is not really a lot of that negotiating that we do on the private sector at all. So you have to read through the contract or request for a proposal and be very clear about what they're asking for. If you're not clear, ask them, the contracting officer, to get clarity and make sure that you're submitting the things that they're requesting in a timely fashion. Because if you do not, your application or your submission will be moved to the side. You will no longer be considered. And that's the case for federal, state, and local. So I've been talking for a little bit, guys. So I'm going to give you guys the opportunity to ask some questions. Like I mentioned before, you'll have access to the video moving forward, but I'll also send the video to everybody in a group chat along with the presentation so you can take a look at it a little bit more. And it'll have all the websites and everything that I've already kind of touched on as well. So feel free to drop your questions. And you can ask questions about that FEMA contract. And I'll talk a little bit while you guys come up with the questions that you have. Okay. I see a question here. Crystal, Sam, do we create an individual or system account? For Sam, I believe you need to create a system account. So it should be specific to your business. So like the individual account would be for your employees, but you should be creating a system account so that they can track your business. Okay. So go ahead and drop your questions, and I'm going to talk a little bit about the FEMA contract, because there's been a lot of conversation and questions around how you guys, or how you would be able to get another opportunity. So the FEMA contract, and this was my response to a lot of people that reached out to me, it moved very quickly. As far as I'm concerned, which is sometimes how the contracts are, it came out of nowhere. I believe it was posted on a Wednesday at like 2:00. The reason I found out about it was because somebody who I had previously spoke to reached out to me, and I didn't really know anything about what it was about, except for that it was something dealing with the federal government. Now, I will say this, though. I had previously, maybe earlier that day, heard a governor in Maryland mention that he was going to be opening up a FEMA vaccination site. So like everybody's state has your state level vaccination sites, but this particular governor said that he was opening up a FEMA vaccination site. So it didn't surprise me within the next day or so that the contract was out there. So I would encourage you guys to definitely follow your governors, because I follow that governor. He's the governor of Maryland. I follow the governor of Delaware as well, and Virginia, because I'm in those states quite often, and Washington, D.C., the mayor, because they'll give you a little bit more insight as to what's coming down the pipeline. Okay, Vivian, how do you propose a rate for government contracts, and are there rates similar to your normal facilities? That's a good question. So that was something that I definitely had to get walked through, because we had to submit proposals for our rates. And this is the way that I was told to do it, which makes sense. It's very similar to what we do on the private side, is to find out if other agencies have submitted have been awarded similar contracts, or other businesses. So we already know that there was a contract out there for testing. So testing is similar to vaccination. So if you go to, and I'm going to post it here, but I'm going to tell you, like I said, I'm going to show you guys in the presentation. If you go to govspin.com, and I might have to double check that. That'll tell you who's been awarded what and how much they got for that award and how they're spending it. And what's great about that, which is a little bit different than, what's great about that, a little bit different than the private side, is you get the information freely. So if Crucial or Aya or Favorite had a contract and they were given $1 billion to do the COVID testing, you can see the exact number. You can see the full contract amount. You can see how much you're getting on a monthly basis. You can see the types of positions that they filled. So you're kind of getting a full view of what they did. And I was told that you want to do something similar or something competitive to what they offered. Okay. Let's see. Okay. So that's how you determine the rates. So for instance, if you were looking for temperature screeners, that's something a lot of the federal agencies are or have openings for. You can go to GovSpend, and I'm going to double check that website. I don't know if it's Gov. I think it's GovSpending. You can go to that website and see what they paid for those temperature screeners. And you can do something similar. Okay, it is GovSpend. Okay. You can do something similar. So because all the information for federal contracts and state and local contracts is public knowledge, it really is a matter of hitting those right websites to see it. So the answer to your question is it's a little bit similar, but the information is more readily available. So you can find out how much they charge for nurses for COVID testing or for temperature screenings at the Veterans Administration. So that's an easy way to find out. In regards to PACT, is that a social media group or website? It's a website. So I believe it's an organization. I don't think it's a government website, but I believe it's an organization that works with the government. Okay, any other questions? Guys, that's what I'm here for, guys. I'm here to kind of tell you what you need to do, give you some information. Some other agencies to consider. So I mentioned it before, to look for contracts when you go to beta.sam.gov is Indian Health Services, which is a part of Health and Human Services. So Indian Health Services has a lot of contracts, especially out on the West Coast, and they have pretty, smaller level contracts. And when I say small, I mean less than 50. As well, Veterans Administration is always looking for assistance with placing staff. As well, Department of Defense, Health and Human Services, Federal Bureau of Prisons. They're also one of the agencies that are known for having a lot of contracts. And also think about this, and this was another question too that came up in the group. You don't have to staff nurses and healthcare professionals. You can staff anybody. So there's no requirement if you say, well, I'm a healthcare staffing agency or a medical staffing agency, that you only have to staff that. If you're a staffing agency, which we are, you can staff for environmental services, you can staff for maintenance, you can staff for housekeeping. So if you see those opportunities, I would encourage you to apply your agency for those things if you believe that you can staff for those types of positions. Okay, so Vivian's asking, are the prime agencies act as an MSP? How do they profit when using subcontractors? Sort of. So sort of, I would say not as much, because the prime is actually responsible for a lot of your reporting, which isn't something really done in the MSP. I feel like MSPs are a little bit more hands-off, at least in the healthcare arena. And also another thing to consider too is there are MSPs in the federal government. So like I said, when I share the documents with you guys, I'll show you those links to those websites. So the federal government also uses MSPs as a tool. And then as far as like the subcontracting, they profit because much like the MSP relationship with agencies, they're getting a percentage, but not necessarily doing a lot of work. And it allows them. So these are two reasons why some agencies might do a subcontract. One, they want to get a contract with that particular agency. For instance, they want to work with FEMA, but they haven't been able to get a contract for whatever reason. It could be staffing, it could be their rates, it could be anything. So having a sub in place allows them to limit the amount of work if they don't have like that internal manpower, and then get credit. So for every time that you are able to place or awarded a contract, you get credit to the government credit, in the sense that if you try to apply for another contract within that agency or another agency, they'll look at your previous work history. So that was one of the requirements that the primes had to do on their submission that they did. I think it was March 3rd they did the first submission, was what was your previous work history or your previous staffing history. So that's another reason why primes also do those subcontracting relationships, is because they don't have to do as much work, and but they can still get credit. And that's the same benefit for the subcontractor. You will do more work, but you can use that as a reference to get that next contract where you can either be a sub or you can be a prime. And it's a great way to understand the process. Okay. Shanika, when asked to write a proposal for the government contract, do you provide a proposal example, or do they provide a proposal for the agency to fill out? Right. So what I'm referring to is you'll see things two different ways. So you'll see things as a request for proposal. So the link that I shared with you guys in the actual events, and the link that I shared in the group, and I'll put it under announcements, where Jarvis or Edward asked the question, that link is to a request for proposal. And they list in the request for proposal specifically and exactly what they want you to submit. So 9 times out of 10, it'll be a request for proposal, or you might see a pre-solicitation to bid. And what that is that they haven't sent out the request for proposal yet, but they're looking to see if there are businesses that can help them meet the need. And those are great opportunities, and great things to follow, because a lot of times your pre-solicitation to bid will down the road become a request for proposal. So everything that the agency needs to submit will be listed, bill rates, scope of practice, previous history. For this one, which I think will be interesting if they're able to hit their timeline of April, they also have to do presentations to the contracting officer. So they'll be doing Zoom presentations next week, the 36 primes that submitted. Typically, I don't think that you have to do that, but I think because this is such a big contract, and it's under a lot of scrutiny, because it's in alignment with the president's desire to get X number of people vaccinated within his first 100 days. So they want to definitely make sure that they get it right that first go around. So any other questions, guys? And like I mentioned, you guys will all get the information, the video, the presentation, and then the invite to the group. So there will be a group called Local, State, and Government Agencies, where probably in the next couple of weeks, I'll start to drop some opportunities there for you guys to look at. And that'll kind of give you an idea, and then potentially maybe start doing some Facebook Live similar to what I've done in the NOSA group. But there's a lot of opportunity. If you haven't, sign up with Duns and Bradstreet. I'm not going to say the process is easy, but it's free. So you shouldn't be paying for it. Definitely register with SAMS. I know so far that the only state that already registers you with Duns and Bradstreet is Florida. I think maybe Texas too. I think we have somebody in Texas. Maybe y'all will know. So Crystal, tell me, you already have a Duns and Bradstreet, right? Because you're licensed in Florida. Okay. Okay, this is a good question, Lisa. Do I need to have an SBA certified to get into SAMS? No. So you don't need to have anything special to get into SAMS. The only thing that you do need to get into Duns and Bradstreet is your EIN number. The SBA certifications allows you to get preference. So when you are going through a request for a proposal, some of them will say set aside. And what that means is it's set aside for small businesses. It's set aside for minority-owned businesses. It's set aside for veteran-owned businesses. It's set aside for small veteran-owned, disabled, minority, women-owned businesses. There's so many of those certifications and credentials. It's really important to, as you're kind of waiting to, go to SBA, they have a quick little lookup to say what you'll qualify for, HubZone, 8A, all of that stuff is out there. And then if you qualify based on how you answer the questions, they'll help you start the process. Some SBAs will also connect you with a local mentor. And there's a big push, and that's why I talk about SBA and Small Business Development Center so much, is because there's a big push because small businesses were hit so hard by COVID to kind of regroup them, to kind of support them. There's so many sessions. I share with you guys all the ones that come to me from SCORE, SBA, Small Business Development Center. There's so many organizations running sessions to help people maneuver through the process a lot more than they did before, because they want to revitalize and really push people to either, regroup your small business, help point you in the right direction. If you decided to get the PPP loan, how you can use it, some things you can do, and just give people way more access and information. So this is a great time to really get into that. There typically are some requirements. I think for like the woman owned, it need to be 51% of the business needs to be owned by the woman. So there are small requirements that they'll ask of you to kind of fully meet the process. To fully complete the process. But I encourage you, it's definitely worth the time. So, all right. So I think it's about 9:19. If you guys don't have anything else for me, I'm going to go ahead and wrap it up. I'm just going to recap a little bit about what we talked about. If you do have a question that comes to mind before I finish, feel free to share it. Like I mentioned earlier, you guys will get all the slides, you'll get the video, and you'll also get access to the group. It's a great opportunity, especially for small agency owners, to jump into this local, state, and federal space because they are being way more supportive about the process. I think it was something that many people stayed away from because it can appear initially cumbersome, but they're really doing more to support people who are starting small businesses or started small businesses to kind of move into this space. So it's one of those things where you want to, if you're going to get into it, just like with healthcare staffing agencies, if you're going to do it, this is the year. I would encourage people to go out there and do it because there's so many things happening, but in a good way, as far as healthcare staffing agencies who may have had roadblocks years prior. A lot more doors are being opened. People are way more flexible. The need is greater than we ever seen it before. The demand is outrageous. So a couple of things just to remember. Duns and Bradstreet is here in the comments scroll. So register for your Duns and Bradstreet. You have to do that first. Get your number. Have all your documents ready when you register so that you don't have to go back and do it again. Then register for your SAMS. And once you get that, you're kind of mostly ready to do the process to submit for government contracts. Some things to consider as you go along. If you're planning to kind of stay in this space for a while, look into getting your local or your SBA certifications for minority owned, women owned, veteran owned, disabled, 8A, hub zone. And there's a couple other, I believe there's at least 20 designations you can get. As well, look for subcontracting opportunities. A great way to look for subcontracting opportunities, if you see a job that's closed or that's awarded that you might be interested in, reach out to the agency or business that received the award. Sometimes, making that contact just like you would do on the private sector side kind of gives people that connection. Another thing to look for subcontracting opportunities is to network. So networking on LinkedIn, networking on Facebook, Instagram, all these social media platforms, Clubhouse, really allows you to connect with people who are in the same space as you are, who might have some insight or might be looking for you. Okay, so Miriam confirms, in Florida, you just call DMB for your number. So in Florida, when you register your business, you do get your Duns and Bradstreet number. So for all my Florida notices that are on here, if you've registered your business with the state of Florida, you do have a Duns and Bradstreet number, so you need to connect with them. Okay. Okay, so April's asking, while being a federal government contractor, do you know anything about what type of business account you should have, meaning nonprofit, credit union, federal bank? Do you know if any of that makes a difference? It really doesn't make a difference. I will say this, typically for the federal government contracts, you're not going to be able to do 1099s. I know there's a couple of people in the group that do 1099s, with the exception of for your physicians. So that's something that I would definitely take into consideration. But whatever bank or credit union that you use from a business account standpoint of view should be fine. Like, I don't think it matters unless you're intending to maybe do like some of your SBA or VA loans. That might sway me to one versus the other a little bit more so. So thanks for the question, April. Where to look for the contracts, guys? I've already told you it's in the group. The RFP for the FEMA contract is there, beta.sam.gov. There's a couple of other resources, GovTribe. Where you want to look for government spending is govspending.com. As I mentioned, all the sites that I'm referring to will be shared with you guys, so don't try to remember it. But please familiarize yourself with some of the acronyms. So when you're reading through different contracts, a lot of the acronyms are going to be used. Some of the frequently used ones are RFP, which is request for proposal, CO, which is contracting officer, DUNS, which is your data universal system. And this one, and I didn't get a chance to really touch on it that much, is your NAICS, NAICS code. Which is essentially it's a North American Industrial Classification Standard, and it classifies standard roles. So I'm going to put it here, 561320 is the NAICS code for temporary health services. If you go to beta.gov.com and put in this NAICS code, it'll bring up contracts related to this. But there's a lot of other ones that are similar. But usually any staffing needs will drop into this particular, I'm going to put NAICS on here, NAICS code. So, and go in there, play around, look, see, get a feel for what's out there. Get a feel for what's out there just so you can familiarize yourself. Okay, and Marie, I'm going to get to your question. when you're looking at your RFPs, make sure you're looking at, like, the places I look, because like I said, they can be very large documents, is your statement of work. That's going to tell you what they're looking for, and your scope of work. And that's going to tell you who they're looking for. And then, of course, you always want to look for your deadlines and things. If it's a set deadline or a tiered deadline, you want to look at that as well. Marie, what advice would you give new agency owners? I would, as you're getting ready and getting up and going, I would still get your Duns and Bradstreet. I would still get your Sam's numbers to have them. You never know when opportunity knocks at your door. So it's always best to be ready. The one thing I will say, when you're trying to get a subcontract, and this will touch a little bit on what you're asking, April, is typically primes look for subcontracts because they have something that they don't have or that they don't want to do. So in our case, a lot of times is access to people. So if you're intending to operate as a subcontract, you want to make sure that you have the numbers or the network. So I tell people, I think when me and April were talking, you guys have access to a network through the NOSA group, but you also want to make sure that you're building your own network, because what if the opportunity was state specific? So you really want to take time on branding your business as a new agency owner and building your network. So if, say, Prime reaches out to you, and Marie, tell me where you're from, and they're looking for needs to fill 50 positions at a vaccination clinic in, I'm going to say you're from Maryland. Okay, Marie. In Maryland, could you send out an email? Could you post on a Facebook group? Could you post on your Instagram? Could you post on these different platforms that your business is located, or be able to access 50 nurses that would at least reply back to you or more to meet that need? So that's kind of the thing that you want to consider when you are talking with people about subcontracting in the staffing arena is, do you have the numbers? Do you have the network? Do you have people that'll show up and meet the need? Because if you don't, then that creates a problem. So the needs aren't typically as big, but you want to say, hey, if they need 10 ICU nurses and they want to subcontract with you, do you have 10 ICU nurses? Do you have access to them? Can you get them rolling or moving in the process? And that's a little bit more than your typical job, because this should be people that you can text, email, call, and they're going to answer. They're not going to treat you like recruiters. So these are people that you actually can get in touch with fairly easily and get a response, whether it's yes or no. So I hope that answers your question, Marie. A couple of things that I mentioned as far as agencies to consider: Indian Health Services. They always have something open that people overlook. Indian Health Services, Federal Bureau of Prisons, Department of Defense. Every military installation has a hospital, and their hospitals are run by the federal government. Some popular ones are Veterans Administration, Health and Human Services, CDC, the FEMA. At this point, FEMA always has a need. So those are just some of the agencies to consider, as well as, state veteran homes, agencies and facilities and hospitals that are run at the state level. Some of your psychiatric hospitals are run at the state level, or mental health facilities. Some of your developmentally disabled facilities are run at the state level. So those are also opportunities for you to provide staffing services there at that level as well. So definitely look into that. I know I spent a lot of time tonight talking about the federal one. I wanted to really touch on the contract that everybody or that was mentioned in the group a little bit more than to talk about the local and state types of contracts, but they have a similar process. They typically come out as RFPs. Some of them are set aside for specific, veteran owned, minority owned, or women owned. A lot of times it's a little bit less of that at your state and local level. If you're looking to find them, I mentioned, for Delaware, it's bids.delaware.gov. If it doesn't have a .gov or .co.gov in the link or the website link, it's probably not legit. And it's probably somebody who is selling services for you to access it. So for the most part, for your federal, state, and local, you should be able to access them freely. I think some states, maybe even Florida, may have a vendor management system or MSP type of system that you would need to do it, but you should be able to access and see the jobs without paying someone to do that, okay? Alrighty, so thank you guys for hanging out with me. Remember, when you're out there in that space and you're looking around, you see something that you might be interested in, do your research, read the whole RFP, read the whole thing. It might take you a couple of days, but read, highlight. That's what I do to make sure that you have an understanding. Ask questions. That's why they have contracting officers there, so that you can ask questions to get clarifications. Typically, your RFPs do have a question and answer attachment that you can list questions out, and then maybe like a week into the RFP being open, they'll post the questions that businesses ask and answers that they're given. Be prepared. Like I said, any opportunity can come out of anywhere, so you want to make sure that you're prepared and have your ducks in a row, that you can provide what you say it is that you can provide if someone does reach out to you. Make sure that you're properly positioned as well. And what I really mean by that is just saying that you can manage the workload. So for instance, if, say, myself or one of you guys got an opportunity to staff 50 people, do you have payroll to manage 50 people if the determination is that the subcontractor will do the payroll and get reimbursed? Do you have credentialing to manage it? So you want to have all those things in place so that you're able to make it a seamless process and a good experience for yourself and the prime that you're working with. As I mentioned earlier, establish the network. Do that now. So establish your network now. The NOSA group, which is a network, has been around for 2 years, and we're close to 2,500 members. So with that, it allows people to have an understanding of what your brand is, what you're about, what your business is about, what types of staffing that you do. And so that once you're in a position where you might need a lot of people, you're able to push those people into place to meet whatever need that they have. Subcontracting, like I just said, you want to be able to sell to them. If you reach out to them, whether it's through LinkedIn, Clubhouse, Facebook, Instagram, what's the benefit for them? That's what I did when I did this opportunity that I mentioned for temperature screeners. I saw it. I felt like I was a good fit, and I was able to tell them what's in it for them. So thank you guys so much for hanging out with me tonight. I apologize for the technical difficulties, but sometimes that's just what it is with Facebook. So definitely, if you have any questions, you can message me. Like I said, I'm going to create a group chat for you guys who attended, and I'll drop the video there as well. It'll come through to you guys on Messenger, so you'll get the video, you'll get the presentation, and then you'll also get access to the group. So if you have any questions, or if you have anything you want myself or anybody else in the group to look at, feel free to do so. And you can always check out the video again. You'll always have access to the video, but you'll receive a link from me to give you easier access. So you'll always have access to the video here under your events tab. So I hope you guys have a great evening, and I will be chatting with you. Good night. Have a great weekend, everybody. Hmm.